Amy, CDC's got their eye on the ball. Letter obtained by NPR, signed by more than 1,000 employees at the Centers for Disease Control, reads in part, at CDC, we have a powerful platform from which to create real change. By declaring racism a public health crisis, the agency has an unprecedented opportunity to leverage the power of science to confront this insidious threat that undermines the health and strength of our entire nation. The letter addressed to CDC Director Robert Redfield.
Oh, that Robert Redfield who said if we all wear a mask for 6 weeks, Dan, we could put COVID in the ground.
Yeah, the CDC, I thought, didn't we have this conversation a couple months ago? One of the things that we've learned from the response, CDC, NIH, mission creep is a problem. Agency mission creep is a problem. When you get far afield from your mission, you don't do a good job of fulfilling your mission. And so the FDA, CDC mishandling or lack of preparation for the necessary testing capacity back in February that put us behind where we could have been. I thought that was one of the lessons learned. Apparently not by more than 1,000 employees at the CDC that now want to play racial politics in the context of the presidential election rather than, I would think, be just about all hands on deck. I know you can do more than one thing at the same time, particularly in a big agency. But I would think most hands would be on deck and most focus would be on this pandemic that seems to be dominating the news and the policy making.
It dominates the air we breathe, how we're living life.
It's just remarkable, and it says something about the culture inside some of these government agencies that should not go unnoticed. Well, HHS Secretary, speaking of another agency, he was in town yesterday.
Yeah.
And talking a little bit about school reopening.
Yeah, Craig Wall from ABC7 got the exclusive. He was there while he toured Rush University.
They get a lot of their health care at school. They get a lot of their mental health care at school, nutrition at school. And that's on top of the social, physical, intellectual development that kids need and can only be fulfilled in a physical environment.
And Dr. Scott Atlas, the former head of neuroradiology at Stanford Medical Center, was on with Martha McCallum, repeating somewhat what you've heard him say on this show when we've spoken with him as well. And he's not alone. He's sort of incredulous that we're having this conversation about whether or not to reopen schools, not just based on the science, but even based on Tony Fauci's exchange a couple of weeks ago with Rand Paul now before a Senate committee, where Rand Paul was making the case for school reopenings, and Tony Fauci said he agrees that we need to get kids back in school. So what exactly is the counter argument? I'm not sure I'm hearing one. This is Scott Atlas.
2 points I want to make. One is that teaching is a young profession. In the United States, half the teachers are 40 or less, and a quarter of them are under 30. 90% are under 60 in public schools. They have almost zero risk from this. And for those high-risk teachers, which there are some, if they believe in masks and social distancing, don't they know how to do that by now? And if they're still afraid to do their job, why can't they teach from a distance? If they think social distancing works, teach in the class. If they think distance learning works, teach from home. But the problem here, and this is the biggest point of all, I never hear anyone talk about the harms of closing schools. The harms are against the children. Anyone who prioritizes children would open the schools. That's just counterfactual to say that, the children are not the risk or, we're at risk here. When we see the harms to children, most children learn most of what's in school from social engagement, from learning how to resolve conflicts, from dealing with others. This is obvious. When children learn that they need a hearing aid or glasses, that's done in school. There are over almost 250,000 apparently reported child abuse cases missed because children's child abuse is most noticed in the schools. And so, I'm not sure. We are the only country in the world. This is a level of hysteria. This is something, I feel like I'm living in a Kafka novel here.
We're Andrew Sullivan said we're all on a college campus now. I think Scott Atlas is right. We're all in the castle right now.
But also teachers, have you ever seen them complain so much? If you go to Facebook, they're blaming Trump. He's putting our lives at risk. Have you heard nurses, doctors, meat packers, truckers, grocery store workers, flight attendants? They've been around the public. They haven't complained at this high level that teachers are complaining right now.
For more on all of this and more, we're pleased to be joined by Alex Berezow. He's the Vice President of Scientific Communications at the American Council on Science and Health, PhD microbiologist and columnist for USA Today. Alex, thanks for joining us again. Appreciate it.
Thanks for having me on, guys.
Is there a case to be made for keeping schools closed?
I'm having a hard time understanding what it would be.
Uh-huh.
I think that I don't support any type of top-down decision. I don't think that if we believe that local jurisdictions have autonomy to some extent and are able to make local decisions on their own without interference from the federal government, that's sort of a standard conservative position, then I think schools should make those decisions on their own. Let them decide what they want to do. But my goodness, I think we ought to open them up. The damage that we're doing to kids. I mean, essentially what we're doing is a gigantic social experiment on our children, which is, well, let's see what happens to a bunch of kids if we don't let them see other kids for several months or a year, and we interrupt their education and development. Let's see what happens to them. Like, that's essentially what we're doing, and I think that's a scary experiment that we're doing.
I just wish so badly that, superintendents, because it's going to be up to the school districts individually, at least here in Illinois, would see what's going on in Europe and how they don't have a mask culture. They went back to school, granted at 50% in May and then 100% at the beginning of July because school doesn't get out until the end of July. And they haven't had any outbreaks, but they don't social distance and they don't wear masks. So how are they looking at that data? Is there any way to wake them up here to see what's going on in Europe?
Well, I'm not familiar with what's happening in Europe in terms of schooling because I don't have a school-age child myself. My child is 15 months old, so she does not practice social distancing. I'll point this out.
Yeah.
And I'm sure she better not be wearing a mask.
She's not. And but I think the idea that we should – I completely agree with the gentleman that you played an audio clip of. The idea that we're even having a debate should schools reopen is insane. Obviously, they should reopen. The question is how do we do it? How do we do it in a way that keeps teachers safe if they're afraid? How do we do that keeps parents safe if the kids get sick and they bring something home? That's the sort of thing that's the sort of conversation we should be having. How do we prepare for reopening our schools, not should we reopen our schools? That's the wrong question.
Yeah. Well, I think what we're finding out, and because it's very interesting on a college campuses like Georgetown, professors can choose to teach in class or not teach in class. There was an op-ed in the Wall Street Journal about one who's going back to teach, an ethics professor, explaining he feels it's his obligation to do so. But at the K through 12 level, it's not happening. Now this gets beyond the virus and microbiology, but I mean it's just very clear that there is resistance based on convenience and based on the interests of the adults, and frankly based on the structural infirmities of centrally planned systems in terms of trying to be nimble and make accommodations for some teachers while making different accommodations for other teachers. They just don't want to do it. It's just that's what it is. They just don't want to.
Right. It's a one-size-fits-all. If one school does it, they all have to do it. If one teacher does it, they all have to do it. And that is just, it's bureaucratic groupthink that is very, very, very counterproductive. And the inflexibility of the bureaucracy and of teachers' unions, and it's infuriating.
I wanted to get to a couple other topics under the umbrella COVID-19 here, including this piece that you wrote about vaccines, as we got some good news from the Moderna vaccine trials, I guess that will expand towards the end of this month. We got some good news yesterday in terms of the fact that the 45 or so patients in trial were actually producing antibodies when given this this potential vaccine. But you point up some cautionary notes about vaccines, since we're looking at anything that may come to market under the rubric vaccine as a panacea. The vaccines change susceptibility to unrelated diseases, sometimes for the worse. Explain.
Yeah, so this has actually been known for quite some time, that vaccines can have off-target effects or non-specific effects. You inject somebody with a vaccine for a disease, and then they all of a sudden seem to be immune to other diseases we didn't vaccinate against. And this was discovered with measles, for instance, that kids seem to do better against other respiratory diseases when they're vaccinated against measles. Same thing now we found with tuberculosis. The people who are injected with the tuberculosis vaccine, it's called BCG, seem to have a benefit against other respiratory viruses. Why? Who knows? The immune system is incredibly complicated. We don't fully understand it. And there seems to be some benefits to getting a vaccine that go beyond what we would expect. On the flip side, there seems to be some downsides to vaccines that go beyond what we would expect. And there's been some research that shows some negative health effects from various combinations of vaccines, or some people getting vaccinated and being more susceptible to other illnesses. This is not really a concern in our country because we have an advanced healthcare system, and if any side effects happen, they can generally be treated and taken care of in the hospital. So these negative effects were seen in Africa, like extremely poor countries. So it's not a concern for Americans. But having said that, when you develop a new vaccine, you have to keep all this stuff in mind. And there have been cases where you give someone a vaccine and they actually have a worse reaction to the disease than a better one. This happened with a virus called respiratory syncytial virus. Back in the 60s, we created a vaccine, we injected it into a lot of kids, and 2 of them died when they got respiratory syncytial virus. And the reason is because the vaccine didn't work. So that's why when people say, well, we need to get a vaccine fast, we need to have one now. No. This is a drug that you take very slowly. You want to make sure that when you inject it into millions of healthy people, that you're not going to make some of them sick or worse. And so people who are wondering why it takes so long to make a vaccine, well, that's why.
And there's a lot of anti-vaxxers out there. I know, measles, 100,000 kids died from the measles last year because parents are not vaccinating as they used to. Do you know, what is their reasoning behind those choices?
Well, they are holding on to information that's just simply incorrect. They are saying things like the MMR vaccine itself is not safe. That's just simply not true. It's not linked to autism. It doesn't do any of those things. The arguments the anti-vaxxers are using are bunk. They're disproven arguments. So whenever we hear information, whenever I see scientific information that comes out that casts vaccines in a negative light, I automatically think, oh no, this is just more ammunition for the people who are going to cause problems. And I'm always worried about that, but I'm a scientist. I believe in seeking the truth, and sometimes the truth is uncomfortable. It's oftentimes complex and nuanced. But good heavens, try having a complex, nuanced conversation in America in 2020.
Yeah, no, just tell us beautiful lies, Alex.
Yeah.
Just tell us beautiful lies.
It's all going to get better.
Mick Mulvaney, former chief of staff to the White House, president in the White House, said we still have a coronavirus testing problem in this country. He's arguing that Congress, rather than just passing another round of checks to distribute, should be looking at whether or not we have the necessary capacity as states are continuing to test and, of course, cases are continuing to build. And this could go on not just for this first wave, I guess, that we're still towards the end of, perhaps, but in the second wave that we're supposed to be making preparations for.
I don't know how anyone can seriously make that argument anymore. At the beginning of this pandemic, we clearly had a problem with testing. We didn't have any tests, and people who wanted them couldn't get them. So, but now we're testing. Oh, my goodness! I mean, we've probably done. I couldn't even guess now, but it's probably in the tens of millions of tests now that we've run. So I don't know how anyone can seriously make the argument that we have a testing problem. I mean, when we're detecting 68,000 cases a day, there were probably several 100,000 tests that were run to detect that. So no, I don't think we have a testing problem anymore, but we have a control problem where we're not able to control the disease. And Europe did get it under control. They implemented tough lockdowns. You do have to wear masks in public. We're here in Poland. I have to wear a mask if I want to go out to a grocery store or something. You have to put a mask on. Now they don't make you do it if you're in a restaurant, but if you're in a grocery store or clothing store or something like that, you do have to. So there are ways we can get this virus under control. It's a control problem in the United States, not a testing problem.
What about a testing accuracy problem? And this is anecdotal, so I present it as such. But there was a Fox station in Orlando reported on labs that have in Florida where we have this case by labs where 100% positivity rate. Every single person that a lab tested was positive. NCF Diagnostics lab in Alachua reported 88% of tests were positive. It seems like very high numbers. Orlando Health, 98% positivity rate. One of the hospitals contacted, Orlando Health, confirmed that there were errors in the report. The positivity rate is 9.4%, not 98%. That's a big difference. And so I just, we've had this conversation about all the lies, damn lies in COVID statistics. But I mean,
Right.
some of the caseload that's driving the media, bat stuff crazy, may be based on just human error or misreporting or inaccurate testing.
I don't want to sound like a math geek, guys, but a decimal point makes a big difference.
Yeah, right. Yeah, exactly. It sure does.
The thing with testing accuracy is that I think there are probably different kinds of tests that are being used. I don't think we're all using the exact same tests everywhere. And so it would be hard to make a blanket statement about testing accuracy. I imagine some are better than others. But yes, one of the problems with doing massive screens is you have a certain built-in false positive rate. That is not on purpose. We don't design tests to have false positive rates. There's just an issue that if you run 100 tests, there's going to be a certain percent that come back positive that shouldn't be positive. Now, if you're getting 100% positive, I would definitely encourage you to look at your test to see what's going on.
Yeah, it should be a bit of a red flag, should it? Yeah, it sounds,
right.
That sounds right. As we think about a second wave, and you already have the modeling coming out about predictions of 120,000 Brits could die in the second wave. I saw that report out of the UK. One model, again, the modeling. What should we be thinking about? What are the lessons to be learned over the last 4 months? What should the policymakers be focused on?
Well, my goodness, I don't think anybody can even answer that question in the United States. I mean, you ask 10 different politicians, you'll get 10 different answers. I guess if I was a dictator, what I would do is I would encourage everybody to wear masks in public. I would encourage people to, or mandate it. I would have hand washing station or hand sanitizing stations everywhere. I would encourage healthy people to get back to normal, and I would encourage people who are frail or immunocompromised or old to be really, really careful. They may want to stay home. They may want to self-quarantine. They may want to limit contacts with friends and family. It's not ideal, but I think locking down the entire society is just not a sustainable solution. It destroys the economy. People get depressed. People are committing suicide. There's been an uptick in opioid overdoses in the United States. This is not a sustainable solution. You can't lock down the entire population. So it's better if we're going to have a lockdown, you just do it on the population that is most vulnerable. You protect them in that way and tell everybody else, keep calm and carry on.
Just on the mask thing, I'm going to push back here a little bit. What do we know about transmission in public? I mean, not I should say in public, but outdoors. Isn't it negligible? Isn't it negligible?
That's my new understanding of it.
Yeah.
Yeah, that's my new understanding of it. That if you're outside, the transmission risk is quite low. So I think wearing a mask when you're outside is kind of pointless.
Okay.
But if you're in a public space indoors, then I would say wearing a mask is a very good thing, because the CDC just now said that 40% of cases may be asymptomatic. Now, if that's the case, if that's really the case, this virus is everywhere, and we just don't know it yet. And then that means that you could be infected and you don't know it, so put on a mask. And the societies that got this under control, Asian societies, for instance, Europe, people are wearing masks. So I was very skeptical of that. I was very skeptical of it. But
I mean, you're a scientific guy, a scientific thinker. I mean, you understand post hoc ergo propter hoc. Wet sidewalks don't cause rain. So you got to give me a
That's
causal
right.
link between masks the experience of other countries. You can't just say this happened and this happened,
For
so one
sure.
caused the other.
For sure. For sure. So the mechanism we think that works is it doesn't. I'm going to give you a funny example. Have you seen the meme of two people and one person is peeing on the other person? Have you seen this on the
Yes.
internet?
Yeah.
My kids
Okay.
actually showed it to me.
Like
Yes.
it's like that, right? That if you are wearing pants and someone pees on you, you're still going to get wet. But if the guy who's peeing is wearing pants, you aren't going to get wet. So that's the idea.
See it?
Is
Yeah.
is
Really brings it
you are
home. Yes. Yeah.
yeah, if you have a mask on, it's not really going to protect you from getting sick. So what it does though is if you happen to be sick and you're exhaling virus and you don't know it, it's much more likely to get caught when you're wearing a mask and you're less likely to spread it. So it's more to protect society from you.
I want to get one more data point here to get you to
Sure.
react to, and how the CDC, because we all CDC numbers. The CDC reports this, CDC reports that, and that's what we talk about.
It's our Bible lately.
But I mean, just in terms of track records and how they do data collection and what they say versus what turns out to be true, what we should the limits of what we can actually know in real time. In the 2017-2018 flu season, there were 239,000 confirmed cases of the seasonal flu reported to the CDC by doctors and hospitals, and 61,000 estimated deaths. That was an infection fatality rate of 26%. However, the actual estimated number of flu cases per the CDC wasn't 239,000, but 44 million,
What?
or 187 times the number of confirmed cases, which lowered the infection fatality rate to 0.0013%, or a death rate of about
Right.
1 in 1,000. The CDC
Right.
has not developed or announced a specific extrapolation model for COVID-19 as it has one for seasonal flu, an example I just gave you. So are we obsessing about data that really is going to end up telling us nothing? It's actually misleading us in real time?
I think that's probably true to a large extent. That when we're focusing on the number of new cases and we're looking at the number of new confirmed cases, that doesn't really tell us anything because we don't know how far the virus has actually spread. And the flu example is a perfect analogy. When the CDC estimates 44 million cases of the flu every year, that's based on surveillance. They're simply doing we had 100 cases in Seattle, we had 200 in Chicago, we had another 300 in New York. If you extrapolate this out, we think there are 44 million across the country. That's how they come up with that number. It's a guess. It's a good guess. And when you do similar thinking like that with coronavirus, you have an infection fatality rate of 0.65%. So less than 1% of people are dying from it. Now, the seasonal flu is thought to have an infection fatality rate of 0.1%. So COVID's around 6 times worse, but it's not hundreds of times worse. It's not thousands of times worse. It's 6 times worse. And so,
Right now, from what we know right now.
For what we know right now, that's correct.
Yeah. Alex Berezow, Vice President of Scientific Communications at the American Council on Science and Health, PhD microbiologist and columnist for USA Today. Alex, always a pleasure. Thanks for joining us.
Hey, thanks. Have a good day, guys.
You
Thanks.
too.
And he joined us on our turnkey.pro answer line.